Welcome back. Thanks for staying with us. Health Minister Dr Joe Phaahla says 85% of the population relies on public health facilities to access healthcare services. He says this puts pressure on the limited resources they have due to the high demand. Phaahla was virtually addressing the two-day primary healthcare conference in East London. The conference seeks to reflect and review the work done since the dawn of democracy in ensuring that citizens have access to quality healthcare. Phaahla says financial constraints and mismanagement of funds are some of the stumbling blocks that needs attention.
Services remains a challenge for most rural communities. For some in the Eastern Cape, patients must travel distances to access services. This community relies on mobile clinics to receive the much-needed health care. It has had residents frustrated as they claim it is inconsistent in doing its work.
We wish to have a permanent clinic because here at Khayelitsha, a lot of people have chronic diseases. It has been 3 months since mobile clinic came here. People have health needs here.
He says they are struggling. They really need a clinic. Other clinics are very far and they must spend money which they do not have to get there.
If only the mobile clinic come at least 3 times a week. Sometimes it doesn't have all services we need. Its services are limited.
Yes, the government maintains that it is on the right track to meet the health needs of the people.
To achieve universal health coverage will indeed require resources. So also as a state we must continue, we must commit, and therefore the current situation of cost containment doesn't augur very well for us, but we're doing our best to make sure that health services are protected. But it is also for this reason that we must continue to look at other ways to reorganize the resources available for the country.
Another facing primary health care in the public sector is the lack of specialist doctors. The National Health Insurance is seen as a solution to this and other challenges in this sector.
It's now undergoing processes in the National Council of Provinces. We are very, very optimistic that in the next few years this bill will be approved by both houses of Parliament, NCOP following suit on what the NA has done. And that will provide really an important legislative framework, one for achieving equity in the allocation of resources, for ensuring that people access healthcare services of good quality based on their needs, not their ability to pay.
The aim of the conference is to address the challenges in the health sector before 2030 as part of the targets set by the National Development Plan. Abungile Yankees, SABC News, East London.
All right, Ramphelane Morewane, Acting Deputy Director General for the Health Programs at the Health Department, joins us now for more. Very good evening to you, sir. Thank you so very much for joining us here on SABC News.
Good evening, Flo, and good evening to the viewers at home.
All right, so at this conference, it seems that the minister was bemoaning the fact that there's so much reliance on public health facilities and that it puts a strain on resources, talking about the fact that 85% of the population relies on public health facilities. Should the state not be equipped for, even if, you know, in the eventuality that 100% of the population relied on public health facilities?
Good evening. Thanks very much again for having us.
Sure.
Look, you realize that the resources of the state are not limitless, but if we talk about the totality of the funding of the health of the people, who would have enough resources to cater for all South Africans. So currently, true, the majority of the people rely on the public health facilities, whereas the big chunk of money that is in the private sector. And we need to talk about a healthcare That's not impoverishing. A healthcare where people don't have to go deep into their pocket in order to access care. So the current system is that pass a private health facility nearest to where they live in order to go and access a public health facility that could be maybe 5 kilometers away from them. And we're saying that's not affordable, that's not acceptable, because people need to be close, need to receive services closest to where they live.
Yeah, and of course, part of what this conference was seeking to do is to reflect and review on, the work that has been done, since a democracy. So, what can you say, or what was the final note in terms of what actually has indeed been achieved? What is the work that's been done since the dawn of democracy to indeed ensure that citizens do have access to quality healthcare? Should we connect then with Mr. Ramphelane Morewane, Acting Deputy Director General for Health Programs at the Health Department. Of course, on the back of the Health Minister Dr Joe Phaahla saying that 85% of the population relies on the public health facilities to access health care. This at a primary health care conference, of course, as they review the work done since the dawn of democracy. And Mr. Morewane, that's where I'll pick up. I mean, we were talking about, what have been indeed those achievements, as of course you discuss and review and reflect on the work that has been done since the dawn of democracy to ensure that the public do have access to proper health care. Let's talk about what indeed has been done during that time.
Yeah, no, apologies about that glitch.
No problem.
As I was saying, it's a well-known fact that since the dawn of democracy, a number of improvements in the way health system is run have been implemented. The first thing that people must remember is that there was a removal of user fees at the primary healthcare level for pregnant mothers and children. So that was meant to ensure that those that are very vulnerable are able to access the services, but also to ensure that people that enter the system at the lowest level of care do so without any hindrance. That's the first. The second thing is that over 1.9 thousand clinics were constructed, and in the years just following, we then implemented what we call Ideal Clinic. The Ideal Clinic is meant to become a catalyst for improved continuous quality improvement in the delivery of primary healthcare services at the lowest level of care. And to date, we've got over 1,900 clinics that have attained that status out of 3,400 clinics. The department has also been able to deploy skilled people through what we call district clinical specialist teams in the deep rural areas to support those that are frontline workers on the ground through skills development, ongoing training, to ensure that when they come across difficult situations, they know what to do. So there's also been ongoing maintenance of these health facilities on the ground. And people must know also that over and above just the ordinary buildings and services offered there, this country runs one of the biggest antiretroviral programs, where over 5.8 million people are on antiretroviral drugs.
Yeah.
So this is one of the biggest achievements. So I could go on and on, but I do know that the needs of South Africans in terms of health services continue to grow every day and will never rest until we have reached the last person who needs our services. That is why some of those that we cannot access through building of clinics, they access services through mobile health services, which are mobile clinics that are going to their villages to see them. We also do know that that cannot be adequate, but I think under these circumstances, we're able to reach those people through that particular platform.
Yeah, and I mean, things could be better, I suppose. One of the things that the health minister said, Dr. Phaahla, was talking about the fact that there are financial constraints and, I suppose linked to, because he did manage the fact that there's mismanagement of funds. Is that not an embarrassing situation? Because what we're saying is that we don't have a hold on mismanagement of funds, and one could even say, could call it corruption, in fact, that is actually then trickling down to the fact that it's causing problems for the general public when it comes to access to adequate healthcare.
Look, the need for resources is always going to be there. And as I said earlier, that financial resources are never limitless. I mean, there's always a limit to them. But again, as I said, we need to enter a space where we say, but the totality of the resources the resources that we have in the country, if they were to be directed, particularly those that are delivering health services for everyone, if they were to be directed into one area, so that when people need services, they access them. Let me tell you what makes the health service very expensive also, is that, as I said earlier, someone who's not insured is going to be forced to go past a facility purely because they are not able to pay. And as a result, you end up with a lot of people congregating in one facility where they are all waiting for a few nurses that must see them. Whereas next door, there could be a facility which is underutilized, but they cannot access it because they don't have money to pay to go into that facility. So that's what we're talking about. I mean, there are many incidents where people are even taking a chance at wanting to access government resources through unwarranted and unjustifiable litigations, simply because they think there's a cash cow there that they can go to, and nobody may want to talk about it. But it's the reality of where our money goes to.
All right, so what's the solution? I mean, looking forward, I suppose the conference indeed spoke to, where to from now in terms of addressing those issues. I mean, the conference was held in East London, and I mean, the Eastern Cape in particular, as we know, has been battling when it comes to, issues pertaining to health. So what do we look forward to? Where do we go from this point?
Look, the theme of the conference is the one that really guides us to where we should go to. It's saying towards universal health coverage, strengthening primary health care. So through universal health coverage, we're then going to be able to look at the total resources of the state, those that are devoted for health, so that they are devoted to all South Africans that require health services. But we also know that we would need to enter that space once we have been able to move faster to strengthening primary health care as our anchor and our entry point for every South African that they make contacts with the health system, must be able to make contacts through primary health care. So as we strengthen it, we'll then be ushering a good space to be able to implement universal health coverage. So that's how we can then make sure that the resources that are available are indeed available for every South African for use whenever they need to be assisted in terms of health services.
All right, Mr. Morewane, we appreciate your time here on SABC News. Ramphelane Morewane, who is the Acting Deputy Director General for Health Programs at the Health Department.